A research conducted by Uganda National Institute of Public Health, also known as Uganda Center for Disease Control, has revealed that COVID-19 spreads faster in places of worship, especially churches, than any other places. According to the institute, the research was done in Amoro district, and the findings revealed that some churches do not adhere to the COVID-19 guidelines.
Note that at the time of this farewell party, both the first and the second COVID-19 patients had already developed symptoms, but had not yet tested at that time. On 6th of September, a service was also held at the church, attended by both the first and the second patients. All other patients associated with this party had onset dates from 8th to 29th September after the party was held. Only 26%, that is 16 out of 62 people, reported mask use during this farewell party. So our investigation showed that the risk of getting COVID-19 was 2 times higher among those who were in contact with the first COVID-19 patient and 3 times higher among those who were in close contact with second COVID-19 patient. This means that those who were in contact with these two COVID-19 patients, the first and the second, had higher chances of contracting COVID-19. So we concluded that this social event at this church and the lack of adherence to government directives at that time provided an opportunity for the spread of COVID-19.
Patricia Thiwe, a fellow from the institute, highlighted on the recommendations they came out with after the research.
Based on our findings for this study, we are recommending personal initiative to ensure early diagnosis and treatment to reduce the likelihood of developing severe outcome, prevent spread to others, and reduce the demand on the healthcare system. We also recommend that sick people should stay at home and avoid public gathering, including going to church. Improved adherence to national guidelines and government directives for COVID-19 is also very critical. But most importantly, we recommend full vaccination for all those who are eligible. These findings should reinforce the observance of standard operating procedures like social distancing, hand hygiene, and others now that the churches are open.
She also showed how the research was done.
We also asked about contact with the first case and the second case. We also asked about use of personal protective equipment like mask use, gargles, and others. We described these patients by who they were, like age and sex, where they were coming from, and when they fell ill. Given the frequent attendance of the first and second cases at social events and church events during their illnesses, we suspected at that time that the outbreak could have been linked with contact with the first or the second cases at the farewell party that was organized at that church.
However, it wasn't easy for them to respond to questions from journalists who thought that the research was taken up by the events and time. The scope of the research wasn't concurring with the whole country, among others.
Of these churches, and churches were not supposed to be open at that time. So why we specifically went to Omoro is because I said the numbers were great and they were linked to a church and they were linked by an activity. So these other churches, maybe in Kampala, did not report such activities. That's why we didn't go there. But the findings may be late, but they can inform control measures right now that the churches are being open. Trying to tell the other churches to follow the SOPs for COVID-19 now that the churches are open. If they do not adhere to government directives, then chances are high that we shall have another problem. So I'm telling churches that even if they have allowed them to open, they should continue adhering to the standards. And most importantly, we should have everyone vaccinated against COVID-19.
This story has been compiled by Issa Chigongo for Channel 44 Prime News.